stats earlier today because I thought they were so great. And then another one that I thought would be appropriate just to highlight real fast before we get into today's agenda is awareness. Are you familiar with one of the programs that is, we can label it as a give back program that's going on right now, through a partnership between Healthcare Advocate Summit and the city of Las Vegas and Straight to the Streets? Is this ringing any bells? Are y'all familiar with it? No? All right, 2 seconds. This is actually pretty awesome. So we've talked about the social detriments associated with access to health care. There's so many different things that impact people's quality to access of health care, which produces better outcomes, right? But need exists everywhere. And so homelessness is a need that is pervasive throughout the U.S., especially here. So one of the organizations that the Healthcare Advocate Summit leadership found, again, it's called Straight to the Streets. And there was a notification that came to your Swap Card app. And the whole purpose of it is, so when HAS, Healthcare Advocate Summit, comes to a town or a city like Las Vegas, is there something that can be done to benefit, the population in need, like homelessness here? And so this organization is fantastic. And so the program here is allowing you to go into a link that it should have been in your notification with Swap Card. We're going to get that ironed out and either email it directly to you or have it provided again via your app. But they identified items that are most in need for their patrons that they serve here in Las Vegas. Socks, t-shirts, basic necessities that we take for granted that they sorely need. And so it's a program for Healthcare Advocate Summit to partner with local organizations that exist here, like in Las Vegas, to provide the appreciation and the support, again, underneath that awareness and the communication and the collaboration to help those that are in need. So it's a really cool thing. And another thing that I learned that maybe that was new to me. So any of the furniture that you see up on stage in any of the break rooms or when you go to the networking desk, you see the furniture in there. All that furniture will also be donated to charity, again, for them to use in any way that they feel is, relevant and meaningful to the folks that they serve. So it falls right in line with, that opportunity to support, those in need. So sometimes, we're all here to, learn about how we can increase, access to and outcomes associated with, patients receiving health care. But this is, another way that we can physically, donate time, money, resource, that can help those that find themselves in less fortunate situations. So just be on the lookout for that. So again, it's a way to click into Amazon. The population of items that they deem the highest need, is already in there. And so you can click through, it populates delivery to be directly to the charitable organization. Again, get back to the streets. And then another thing that's super cool, Hanes, the manufacturer, they donated, I think, 500 packs of socks, t-shirts, things like that, again, to go to the organization, because Elizabeth and Melissa, solicited them and asked them for it. So it's, just a really cool initiative, for you to participate in, alongside, your Healthcare Advocate Summit leadership. So more on that to come. It's super cool. So we're going to kick off this afternoon, and we're going to talk about social media, right? It's the new platform for prior authorization, engagement, and there's a couple things that you're going to take away from this. Really 2 tools, and I'm not going to tell you what those tools are, but our awesome facilitators are going to get into that. But one of the things, is to absolutely not back down. And I said it just like that because one of our moderators, I'm going to bring them up now, Julie Bach. Julie Bach, come to the stage, please. Woo! And also, Nilsa. Thank y'all.
We made it. Oh my God, look at that crowd.
I know.
Woo! Come on, everyone. Great. My name is Nilsa Cruz. I am a practice administrator at a solo rheumatology practice in Milwaukee, Wisconsin.
Good afternoon. My name is Julie Bach. I'm a practice manager at a solo rheumatology office in St. Louis, Missouri.
And today our talk is going to be social media is the new
Prior authorization.
boom.
What we're hoping to do today is to give you all our experience, strength, and hope of how we get our patients care, and have you take that experience, strength, and hope, make it your own, and get on a pathway to care for your own patients.
Guys, remember one thing, and we've been doing this for quite some time, right, Julie? What used to work 10 years ago is not working anymore. We all have to be able to step out of our comfort zone in order to get our patients the care they need.
So let's talk about insurance denials. Insurance denials are common.
And they're also rarely fought. So when it comes to insurance denials, let's talk about the 3 C's: common, costly, and compelling.
So common, let's just dive into that one really quickly. We're all patients, we all have that in common. We've all experienced insurance delays and denials, so it's not like this is a once in a lifetime thing. This happens every single year to patients at least once a year. High users of insurance, a rheumatology patient, a chronic patient, an oncology patient, they're experiencing more like 3 to 5 insurance delays and denials per year. So it's really quite a crisis.
So we are looking at approximately 850 million denied claims annually.
Like, let that number sink in. 850 million denied claims in the United States of America in 1 year. Do you know how many lives that is negatively impacting? And these patients, they really should have the job of just healing and getting well. But no, they have to buckle up and get a patient advocate and fight the very people that are supposed to be giving them care. So that 850 million denied claims is huge.
How huge it is turning into a 262 billion with a B of denied care for patients in the United States of America.
So on the costly piece, you know, an individual patient, overall, the number is about $6,000 of patient suffering, of patient denied care, if you count all of the denials. But you have some high users that maybe have a $100,000 infusion, and you have some people that are just trying to get a $2,000 MRI. But overall, the net number is $6,000 per patient per year in denied claims. And that's where she's getting her number of 262 B with a billion in, shall we say, denied care or savings for insurance companies.
That is correct. And if you're looking at a compelling story, let's think about this for a moment. Over 50% of the appeals that we all do are really approved, right? Over 50%. The problem is that they may take weeks, and as you all know, and for sure you and I know that too, sometimes even months. And when you're putting these appeals together for your patients, not all the information that's critical necessarily go in there. And when I say critical, it's critical information that will allow legislators and senators to actually make the ultimate change. And that will be through legislation and laws.
So on those compelling arguments is, I mean, we do this for a living like most of you do, okay? But there's a lot of things I was unaware of. I was just doing it one patient at a time, and some of my cases would take me 100 hours to get the right information to the right people. I was just doing it one patient at a time, and some of my cases would take me 100 hours to get the right information to the right people. For it. I don't know if you guys are paid
I'm not
for
being paid for it. Anyone in here being paid for
I don't know.
appeals?
Yeah, some people can get paid
Show
for
of
patient
hands,
appeals.
0.
I'm not getting paid for it, but I'm doing it because it's the right thing to do. And if we operate in the right thing to do, then our patients get the right care. But 10 billion administrative efforts, burdens, administrative burdens that the insurance companies and the pharmacy benefit managers have no problem sucking our resources out on nonsense like this.
So healthcare shouldn't be a battlefield, right, Julie?
It should not be a battlefield, but it is. And I find it's gotten worse and worse every year. In the past 18 months, I've seen it in my own practice, about a 35% uptick in denied care, and delayed and denied care. So physicians and physician's office, and patient advocates, we answer to patients.
And we all have a common goal too, as you know. Everyone here is a caregiver, and every one of us, guys, is a patient.
Don't forget, insurance companies only answer to shareholders, okay? It is in their best interest to deny and delay care so that they can increase their profit stream.
So what we the people do, Julie Bach, is we turn into social media. Right, so social media also levels the playing field.
So public shaming works. I only do things that work, okay? And I come at things a little hot. Nilsa comes at things a little more politically correct, but both work. And I'm asking you guys to lean into social media because it's the public shaming that the insurance companies, the pharmacy benefit managers, and the self-funded employers, or the fully insured employers, they don't want. They don't want to be embarrassed on social media. But if they would have followed their normal appeals channels, we wouldn't get here.
So I'm going to be a little politically correct.
Okay,
Yeah.
I'll allow it.
You'll allow it?
I will.
Okay. Social media also exposes discrepancies, guys, in care for our patients. So while she might be super hot, and I may be a little politically correct, we all have the same goal. And the bottom line here is that where you're hot or politically correct, we all have to find our own spot, the comfort level, in order to be able to get us a little bit out of that comfort zone and then push forward for our patients.
And I love how she eloquently says, Julie, we're going to expose discrepancy in care for our patients. Okay, what does that mean to me? If you do it for this one, United Healthcare, you're doing it for this one and this one and this one. So that's just a little bit different, the difference in the two of us. It's all effective, it's just a matter of style. So exposing discrepancies probably is going to be the closest thing we can get to policy change, and it's going to take a village. Okay, please just take a second and look at this picture. This picture is the human cost of denials. This is a real patient in my office with a real rheumatologist in my office. The patient's name is Gene. He did a patient appeal ×2. Dr. Bach did 3 physician appeals. Look at this man, how broken he is. He's been broken by United Healthcare. Okay, the very insurance that considers him a member. All right? You can see the concern and care in Dr. Bach's face, and you can see how broken this patient is. Dr. Bach is looking at him and reassuring Gene that we will do everything we can to get him back on treatment. And you know what? We did.
That's right. Remember, guys, there is a human cost for all of these denials.
I love this picture. It should be in a magazine.
Me too. We might see it there.
I know.
And here, guys, pay attention.
There you go. Talk about your...
Me too. We might see it there.
I know.
And here, guys, pay attention.
There you go. Talk about your case.
Oh. She is an outside referral infusion. She has been stable on Remicade for many years. Kelly came to us. She was about to lose her GI doctor and they needed to find an infusion site. She has Crohn's disease I started the prior authorization process with her insurance at the time, which was Blue Cross Blue Shield of Illinois. And guess what happened? What happened, Julie?
Denied.
That's right. Big surprise, big surprise. So Kelly and I got together, and as you know, when you're doing patient advocacy, you have to have a strong patient advocate and also patients shoulder to shoulder. So Kelly and I got together, and we were able to actually find the email address of Dr. Derek Robinson, the Chief Medical Officer at Blue Cross Blue Shield of Illinois. Kelly, our patient, wrote to Dr. Derek Robinson appealing to get her treatment approved because by now she was actually flaring. She did not hear a reply from Dr. Robinson. She did not hear a reply from anybody else. So I decided to deploy a tweet, and you can see my tweet in there. And did Dr. Robinson reach out to my office?
Nope.
No. Did he even reach out to my patient?
Nope.
Nope. He felt it would be easier to block me in Twitter, as if that was going to stop me. Bad idea, you got that right. So one day later, I bring Kelly into the office and I said, let's call Blue Cross and Blue Shield together. And we did. And to our surprise, I don't know how this happened, we found out that her case had entered into a full review, and it was actually approved that same day by 8:30 p.m. Perfect example on how social media influences approvals.
So without her tweet to Dr. Derek Robinson, and he's got some stupid book he's thumping.
I'm not saying that.
From the boardroom to from the bayou to the boardroom, okay? Not interested, Robinson. But again, this case would have stopped at the first Blue Cross Blue Shield of Illinois denial. But she took it up a notch, okay? She tweeted out, Robinson, such a jackassery that he blocked her, but he knew something was going to come of this, and so it got approved. But again, that's not a hard thing to do. Now, I would have done it a little harder, and I'll show you what I'm going to do on mine. But again, she's successful leaning into this and being nice about it.
Right. So there's a little bit of this for everyone. Okay.
Yeah.
Don't think that you have to go best against the wall.
I am.
Right.
Leaning into this.
Exactly.
I'm the mean one. She's the nice one. It's fine. There is room for everybody to use social media and to use a patient appeal.
Right. Take me to the next slide.
I will.
And this is the fun part, guys. So through social media, Julie and I have been able to meet awesome, absolutely awesome patient advocates nationwide. This is one of them. Beth Waldron is the poster child for non-medical switch and advocacy change. Why? Beth was able to reverse CVS's Caremark national formulary on one major drug that was affecting 150,000 patients in this country, and she did that in 6 months. Can you imagine changing a national formulary for a company like CVS Caremark? So she also became a dartboard for CVS leadership. Now, while also meeting great people, please beware, you may be picking up another badge of honor. Yeah. United Health Group blocked me. Can you imagine? Can you imagine? So, Julie, why would a multi-billion-dollar company, you think, block a Puerto Rican living in Cheese State, Wisconsin, at a solo rheumatology office with only 5 people working in it? What do you think that would be?
Well, a multi-billion-dollar international company You have gotten underneath their skin, and they don't want to pay, and they don't care, and they find it easier to silence you.
That is correct.
Bye.
But the no bye here. Not here. Not here. So what happened here was, that actually fueled me. And it got me, I wouldn't say upset, but I would say more passionate about what I do for our patients and with our patients. So it made me pivot.
She pivots.
Yep.
We had to work on her saying pivot with her non-English accent.
Please, don't even get it.
I know, I won't. So let's count the interlopers. One of the first things I do is I scrub an insurance card, okay? This is an insurance card of one of my patients. His name is John. He's a corrections worker for the Madison County government, which is in Illinois, which is on the Missouri-Illinois border. So you've got the front of the card, you've got the back of the card, all right? So you've got interloper number 1 is BJC Health Solutions. That's called Barnes Jewish Company Health Solutions. Interloper number 2 is Aetna. Hey Aetna, we see you. Interloper number 3 is CVS Caremark, conveniently also owned by Aetna, okay? Interloper number 4 on the back of the card, the pre-certification card, American Health Holdings, whatever in the hell that is. Can I even say that? Okay.
Well, these people didn't come here to get bored, okay. So yes, you can.
So on the fifth interloper on this card is a TPA, a third-party administrator called Consociate Health, all right? So this is a little shit show that needs to be funneled down to figure out where these letters go and where these patient appeals go. Can I say that?
You can say that, right? She can say that, right?
She already did.
So anyway, that is one redacted card. But this patient did an appeal, and by God, it was successful. Because we're gonna hit every single one of those 5 interlopers. These are 5 middlemen that are standing between the patient and the physician. BJC Health, Aetna, Aetna times 2, CVS Caremark, American Health Holdings, and Consociate Health. So it's no wonder patients don't know which way to go. I barely know which way to go, but I can help you guys scrub these cards and we'll pull it all together. All right.
Let's tell your story.
This is one of my personal favorites. Express Scripts is owned by Cigna. Express Scripts happens to be headquartered in St. Louis, Missouri. So do I. We're down the street from one another. They can come see me anytime. They decline that. I have a 50-year-old female patient that has severe rheumatoid arthritis and also has cancer. She's medically stable for the past 2 years on a Bristol-Myers Squibb, BMS drug called Orencia ClickJet. It is allowing her to keep 2 $19 an hour jobs. Okay, this is a patient that's poor. Express Scripts is rich. This case to me has Aaron Brockovich vibes all over it. Patients, we go to do her prior authorization. It's immediately denied by Express Scripts International. I don't even know why we have to say ESI, that's their lingo. Express Scripts denied it. Multiple physician appeals. Denied, 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 denied. They uphold the denial. Then somebody at the presidential escalations at Express Scripts, which is down the street from my office, emails me and says, hey, we need to help you get this patient on treatment. I'm like, oh, fantastic. They're like, could you give us the phone number of your patient? I'm like, hold on a second, Alicia. You've been sending her medicine for 2 years. Are you trying to tell me you don't have your own member's phone number? I'm like, I'll give it to you. She goes, someone wrote 99999 in the field. I guess that's their code for we don't give a rat's behind, just put 9s. So I gave her the patient phone number. And do you know what she did? She turned around and called BMS, Bristol-Myers Squibb's Foundation Assistance Program. She verbally, and I listened to the recorded call, verbally filled out the patient's application with my physician's, all of his information, and had Bristol-Myers Squibb Foundation Assistance fax that over to my physician's office to be signed and attested that the patient did not have insurance. That, friends, is called fraud. Hold on. Okay. So then, my friend Warris, Warris is my new best friend. Came here from Topanga Canyon. Warris and I put together this letter to Alicia at Express Scripts at presidential escalations.
That too. So you can actually find these awesome, I mean, guys, this letter was brutal. You can find it on her social media. We're going to give you that information at the end of the talk. And if you're still with us, right? Everyone is with us? There you go. And I mean, it was an incredible letter.
It's brutal. It's brutal. Okay, so I'm on the phone with my friend Warris. I'm sitting on my back patio on Saturday afternoon. Warris is sitting on his back patio in Topanga Canyon, and he goes, Julie, let's email Mark Cuban. I'm like, I don't know Mark Cuban. He goes, I kind of correspond with him. He puts the two of us, Warris, myself, and Cuban in an email, and then I chime in and say, hey, Mark, would you help me with this patient? I don't know what to do with this. I wrote this letter and nothing's happening. Would you tweet that out to me and Express Scripts and the patient's job, the union? And he's like, sure.
And he did.
To his 8.8 million followers. Okay, so then what happens? There's a major media investigation on this mess. Warris and I did a little phone call with the Wall Street Journal to be determined as to what's coming forward with this. Stay tuned, because Mama Bach ain't done with this one yet.
That is the power of social media.
This is the power of social media, okay? It's okay.
So there is a solution, and it's called the patient appeal.
Okay, here's John again in the picture. John's my corrections officer, but the Julie Bach do-it-yourself way takes zero compensation for myself. It takes me on average 113 days to do an appeal. It takes me around 3 to 12 work days to write the appeal, and it takes me about 20 phone calls to these various interlopers.
And the claimable way of doing things recovers literally about $104,000 for one patient. This patient right here, right? A patient who's paying insurance and the insurance says we're not paying for your treatment. $104,000 in 10 days turnover, 30 minutes that it took to the patient just to create this appeal, and 0 calls to any of the interlopers.
So, claimable is a slip. I'm sorry?
Yeah, go ahead.
Claimable and social media are game changers for patients and advocates, because they give you all two things. They give you urgency, and they give you the communication contacts and the direct people that are the decision makers, which are out of reach for all of us. Okay?
Right, so give your patients these two bombshell tools, social media and claimable, and you can rest assured that your patients will most likely get the treatment that they deserve.
This is the QR code for claimable that you guys can take a picture of. We're going to have it in the next slide too, but this is an organization that is doing the patient appeals, and it's fantastic. It feels like an entire team of lawyers wrote the appeals.
You can follow us and learn how to win on social media. You can scan that code, you can get a hold of Julie. That Julie's letter that was tweeted by Mark Cuban is pinned into her account. And all of these faces that you see here are patients of my practice, her practice, everyone's practice, because as you know, everyone is a patient.
So that QR code has every social media handle that she and I use. I have a social media manager, Claudia. She does most of the work. I just do some of the work. But Nilsa does all her work. But my message to y'all is social media and claimable are game changers for your patients. Everybody deserves care. Let's go out and get that.
Woo!